Hello everyone, my name is Dr. Sree Prathap Mohanamurthy. Welcome to part 2 of this video podcast on Alzheimer's disease and dementia. In this particular podcast, I'm going to try to answer to 4 of the following questions. First question is, what causes Alzheimer's disease? Second question is, what are the benefits of making an early diagnosis? Third question is, what is the role of a memory clinic? And the fourth question is, what treatments are available for treatment of Alzheimer's disease? The first question is, what causes Alzheimer's dementia? A lot of research has been done on this particular area. No one single cause has been identified so far, but a combination of different factors are responsible for the development of this condition. The first and the most important risk factor identified is age. So 5% of population over the age of 65 can develop dementia. As the age increases, the number of people who can develop dementia would also increase. The second important factor is genetic inheritance. Say if you have a close family member, then the chances of you developing dementia is higher than in the general population. So if you have a mother, if your mother or father had dementia, or if you had a sibling who had dementia, then your chance of developing Alzheimer's disease is higher, and this risk is increased by 3 to 4 times. So from 5% risk, the risk increases to 15 to 19%, which is about 3 to 4 times. The other important risk factors are lifestyle factors. People who are chronic smokers can develop dementia. People who have high blood pressure, which is not well controlled, can develop dementia. People who have uncontrolled diabetes and high cholesterol are at increased risk of developing Alzheimer's disease. Lastly, environmental factors. It is believed that environmental factors may contribute to the onset of Alzheimer's, but again, it's yet to be identified and still an area under research. Now, moving on to the second part of the discussion, which is getting an early diagnosis and why it is so important. If you are concerned about your memory, or if you're concerned about one of your close family members or friends, then please seek help from a local general practitioner. A general practitioner may ask for a specialist opinion, which could be a psychiatrist or a neurologist. You may also contact a memory clinic or a memory assessment center in your local area for an assessment of your memory functions. An early diagnosis will have a number of benefits. The first important benefit is access treatment. You'll be able to get the latest treatments available to slow down the progression of dementia. Second important benefit is seeking advice and support to you and your family. You'll be able to get the right advice from doctors and other professionals. Your family members and friends will be able to provide more support for you if they are aware of your problems. The third important benefit is opportunity to plan for your future. Say for example, you are in your late 70s. You can write your will when your memory functions are quite intact. Now, a lot of people ask me, Doctor, what will happen in the memory clinic? Or what do you do in a memory assessment center? I'll go through it one by one. The first important part of the assessment is taking a very careful history from the patient, family members, and carers who are looking after them, who are living with them. Then the doctor or the healthcare professional will carry out a mental state examination. You will be given a full physical examination, including neurological examination. You will be given a blood test. But please note that there is no one specific test for Alzheimer's dementia or for any other cause of dementia. But then you can ask me, why do you do the blood test? This is to rule out or identify medical problems, other causes which can present with memory problems. For example, if you have an underactive thyroid, then you may have memory problems. If you have severe vitamin B12 deficiency, then you may develop memory problems. Following this, you'll have a memory test which can last for 10 to 15 minutes. In this test, different areas of your brain functions will be tested. These are simple tests, but the areas tested include orientation to time, orientation to your place, attention, your concentration, your calculation abilities, your short-term memory, long-term memory, reading, writing abilities, language, and thinking skills. Sometimes you may have to undergo a more detailed memory assessment, in which case you'll be seen by a clinical psychologist. The other important test that we do in a memory clinic is a brain scan. Doctors may either do a CT or MRI scan, which may be carried out to look for any structural changes in the person's brain. MRI scan is more helpful to show the degree of atrophy or brain volume loss in different lobes of the brain. Let's move on to the next part of the podcast, which is about treatment for Alzheimer's dementia. In terms of treatment, currently there is no cure for dementia. However, drug treatments are available which can slow down their progression in some people, and it can stabilize some of the symptoms of Alzheimer's disease. So if you take treatment which are called as memory tablets, then the deterioration may be slow. If you don't take the tablets, people may deteriorate quite quickly within few months. So we advise people to take memory tablets to slow down this process and have a better quality of life. Now, people always worry about side effects. These memory tablets have minimal side effects, if at all. These tablets could be taken in the long term because they don't seem to have any addictive potential. Before I conclude this video podcast, I would like to say a few lines which will help to reduce the risk of developing dementia. One important thing is, if you are a chronic smoker, please try to cut down on smoking, or if possible, stop smoking at all. Try to eat a healthy, balanced diet, a high fiber diet with fruits and vegetables, and a low calorie diet. Try to maintain a healthy, optimum weight. Have regular checks for blood pressure and cholesterol from middle age, I would say from the age of 40. Leading an active lifestyle is very important. Especially, you have to have lots of physical activity, do regular exercise, you should do some mental activities, and also you should keep yourself socially active. All these might help to reduce the risk of developing future dementia. So in this podcast, we have seen the possible causes of Alzheimer's disease, the benefits of having an early diagnosis, the role of memory clinic, and the treatments that are available for this condition. I hope you found this video podcast helpful. Thank you very much.